Good morning, everyone. So sorry. Good evening, everyone. So, welcome to Sound Live Facebook Live. Hello, hi. Who is on the line? Can you say hello to me? Today, we are going to discuss how much you know about your ear. And it's very honored that this time we are able to invite Dr. Gan Junjian from Columbia Asia PJ to actually share this topic with us. Hi, Dr. Gan.
Hi, good evening, everyone. Yes, I'm Dr. Gan from Columbia PJ. I'm an ENT doctor. Yeah, it's my honor to be invited by Aliyah, the audiologist from the Sound Life, to this live. And in fact, this is my first time on live talking about something which is important, how much you know about the ear.
Thank
Well,
you,
hi.
Dr. Gan. Hi, hi. So now we have some audience on the live already. Hi, Wendy. So over here, here is we are going to share a series of topic. There's a Q&A. So, Doctor, I will ask you to share some of the. I will ask you some questions, and you please share your insight to our audience over here. So,
Yes, of
hi
course. Yeah.
everyone. Yeah, feel free to type your questions later. If Doctor is free, he is actually will answer all the questions. Okay. So number one, Doctor, as you know that ENT is called ear, nose, throat specialist. So audiologist is like hearing specialist. So people always confuse our role and responsibility. Would you like to just briefly explain what ENT do in general?
Yes, basically, in the medical field, right, we are always working as a team. We cannot work alone. For example, if we want to diagnose a case, we need to know, we have to ask the history, we have to examine the patient. Sometimes we need some blood investigation or some radiological examination. Okay, then only to conclude and to the diagnosis. But in this case, like ENT, ear, nose, and throat, ear is our hearing, many is our hearing, or some ear disease. So hearing is very important. This is like eye, we have five senses. One of them is a hearing. So when we look for any diseases in the ear, especially when it involves the hearing, definitely we'll ask audiologists for help. Okay, the audiologist in this context is very important because we can diagnose clinically. Yes, patient may have some hearing loss, but what type of hearing loss is it? How severe is that? We cannot just tell patient, you have some hearing loss. That's it. Then the patient will ask, what can I do? So at least we have to know the severity of the hearing loss and the type of the hearing loss. Yeah, this is important. That's why we always work together. Sometimes we sit down and discuss with the audiologist. Well, these cases, I think we may need to do something. All right. But what shall we do? Then we always sit down and discuss. Yeah, Aliyah.
Yes, yes, correct. So to add on, actually for the hearing test, it needed to be done using an equipment called audiometer, and we always need to perform the test in the sound treated room or soundproof room. So all this while we have been receiving a lot of referral from Columbia PJ. Thank you, Doctor, for supporting Sound Life.
Thank you for
Yeah.
supporting me as well.
Yes, correct. So, doctor, can you just name maybe some cases that you would normally needed to refer the your patients to Sound Life for the hearing test? What kind of cases that you think that is must be do one? And when you refer those cases to us, what is in your mind that you suspect those patients having?
Hearing loss basically it started from very young age, until the elderly. So throughout this wide range of age, that patient may present with different types of hearing loss. You see, as a kids, they don't know how to complain. Sometimes we may miss the diagnosis. We may miss that the child couldn't hear. But this usually will happen when the parents suspect why the child no response when they call them. Uh, Or another thing is like the child is not really talking, the speech development being delayed. Okay, so from the child, this kind of problems is common, especially they have some effusion in the ear. And the most common one, of course, is the earwax. Okay, earwax, this earwax is actually happen like I almost see every day is in my daily practice in the clinic. Always have patient come in with a blocking ear. And this is the most common cause, the earwax. Okay, earwax problem. In the middle age, especially in Malaysia, well, I worked in Penang before and in Sarawak. These two places, they are very common. Patient present with uh, some disease, which is okay. This disease is common. We have a saying that if a adult present with unilateral hearing loss with tinnitus, it is we have to consider this is a nose cancer until proven otherwise.
I
So you
see.
see, just a unilateral means one side hearing loss in an adult, other than the earwax. The next thing we need to see inside the ear is to make sure there's no effusion in the ear. If that is the case, we have to look into the nose because we know that the ear and the nose, they are connected. Okay, in elderlies, I think Aliyah, you know the most. The
Yeah.
patient who come always is, what you said? I can't understand what you said. Or some patients may, brought in by their children. I mean the elderly. So the children always complain. They always on the TV very loud until I cannot concentrate on my work. Then the elders parents will complain. They always shouted at me, thinking that I cannot hear. This is a very typical uh, things that happen, because the elders when their hearing deteriorate, they cannot hear properly. When they can't hear well, so they have a tendency to talk loud. Okay, or when they cannot hear well, they always will say sorry, sorry. Then the child will increase their tone. So they will feel like why you shouted at me. Yeah, this kind of
Yes. Correct.
situation, it will happen. So
Yeah.
this is common. My practice always I see this type of
It's
hearing
true.
problem.
It's true. Doctor, you just now you mentioned, right, unilateral hearing loss, we must rule out that there is a possibility the person having this nose problem. So other than that, in my clinic, I also see a lot of those of them who are having this symmetrical hearing loss, and the hearing loss type of hearing loss is actually sensorineural. Okay, just to share with all of you, we have for audiologists, after we do the hearing test, we normally will diagnose the person according to the levels and also according to the levels, meaning to say that degree of hearing loss, what is the decibel we actually diagnose them in average. And then the secondly is we are diagnosing the result according to the type of hearing loss. So we have three types of hearing loss. Number one is the conductive hearing loss, meaning the person is having some ear problem at the external ear or the middle ear. Then secondly, we have this sensorineural hearing loss, meaning the person is having the ear issue problem originally from the inner ear. And the third one is actually mixed hearing loss, which is a combine of the first two. So, doctor, usually when we get any result, if the patient came to Sound Life, walk into Sound Life to do the hearing test, we get the mixed hearing loss or we get the conductive hearing loss, we will definitely refer to doctor for management. But maybe over here, many audience, they didn't know the ear anatomy and all this. So, doctor, would you like to just share a little bit?
Yep. Okay. Basically, the ear we divide into three parts. Okay.
Doctor, would you like to put full screen?
All right.
Yes. Yeah.
Now better.
Yeah.
Okay.
Now, have you go to full screen? Or can you share again? So sorry, yeah. So can you just go full screen, then doctor, you share again.
Um. Okay. 1 minute.
So just be patient, and everyone who is on the line here, feel free to like and share this video to others. Today, Sound Life will be giving out some mystery gift. Actually, it's not mysteries. We are giving out 3 sets of this hearing test voucher for people who give the highest share. Okay, so feel free to like and follow Sound Life Hearing at the same time to share this video so that more people can be benefit from this topic. How much you know about your ear?
Okay, can you see the pictures?
Doctor, we can see it.
Okay, basically our ear we divide into 3 parts. This is actually important, you know, because if you know your ear well, then you know how to take care of your ear. You see,
Sorry,
this is
doctor. Maybe
yep,
this one is still a bit small, too small for our audience. Let me share this one.
serious.
So,
Okay,
yeah, it's just too small. So maybe, yes.
then you can help me to share.
Yeah, I will help you to share. Okay. Can you see it?
Yep.
All right. Okay, doctor, feel free to explain.
Well, again, you know, our ear we divide into 3 parts. This is important lah. I think everyone should know their ear well, the anatomy, so that then they will know how to take care of the ear. Okay. Hopefully, after this explanation, you have more understanding about your ear. So then you know what you need to do, what you don't do. Okay, you don't do it. All right. The ear canals, you see, this is the part of the external ear, our pinna, the ear canal, then up to our eardrum here. Later, I will show you some pictures, okay? Yeah, this ear canal basically is about 2.5 centimeter in length, right? The diameter is about 7 mm in diameter. But you can see the eardrum here, okay? Anything behind the eardrum, this part of the ear will be middle ear, okay? Middle ear. In the middle ear, you can see the ossicles. Ossicles is the smallest bones in our body, okay? This is to help to transmit the sound wave from the sound wave into the inner ear, okay? And beneath here, you can see a eustachian tube. It's written there, eustachian tube. Well, this is the part of the ear that it connects to our nose. Where is it? It's at the back of our nose. You know, this place we call a nasopharynx. This part of the nose is a common, as what I said just now, right? The adults with a hearing loss, we have to look into the nose because this part of the nose, the nasopharynx area, is very important because when it blocks, it can cause a blocking ear, and then you may have some conductive hearing loss. And what block it? It can be tumor, it can be due to mucus, it can be due to sinus issue, or some allergy rhinitis. Okay, then we go into the inner ear. Inner ear, in this picture, basically, you can see something like a shell of the snails and the head. The shell is actually, this is what we call the cochlea, is the hearing organs. Okay, then the ear, you can see there are 3 ears. This one, this is actually a semicircular canals. This is for balance. People always say in Chinese, 耳水不平衡. You know, it's
Yes.
always because of here. And you can see this cochlea and the vestibule, they are connected to each other without any borders. So people with hearing loss, very important. Also, we will ask about the giddiness, the spinning, or the vertigo. Okay, vertigo basically is meaning like a twister, you know, spinning, you know, either you spin or the room is spinning. That kind of experience is very scary, actually, for most of the people, right? So, and this part of the inner ear, this organs is very important. It is protected by the hardest bone in our body, which is the petrous bone. Okay, then you can see when the sound wave travels from the ear canals into the eardrum, from the eardrum by these ossicles, then you transmit the sound wave into the cochlea for processing. This kind of process, then it will convert the sound wave into an electrical impulse. This will be transmitted through the nerve into our brain for interpretation. So this is basically a very I hope this is a simple explanation that everyone understand. Okay, this is how our ear works. Okay, and also this is how the ear related to the nose. Then you are with this explanation, then I think you will know most of the disease, how it comes, how it affect our hearing. Okay, Aliyah.
Yes, you are right, doctor. Totally agree. Would you like me to show what happened next for this one?
Well, if you go to any ENT doctors, I think if there's an impacted wax, the first question the doctor will ask, maybe not ENT, maybe most of the doctors will ask, do you use a cotton bud? Yes. As
Or
we
the
know,
ear digger?
ear digger, what they call Q-tips. Okay.
Q-tips, yeah.
This thing is very commonly used by most of the people. Some of them, maybe they use it for more than 20 years, 30 years without any issue. But in general, I would say in general, try not to put the cotton bud deep into the canals. As the previous pictures show you, right? The ear, external ear, the ear canals, is actually canal means is something like tunnel, you see. When it's something like tunnel with a wax inside there, how you going to take out the wax using the cotton bud? You know, this is something like common sense. And some more, the earwax is usually secreted by the external part, external 1/3 of the ear canals. Means it's outside. So
Correct.
in the general conditions, this earwax got a self-cleansing mechanism. Okay, when we chew, when we eat, our jaw will move. This will move the ear canal as well. So this kind of movement, together with the ear inside, there's some self-cleansing mechanism. It will clear the wax from inside out. So this is natural. We try not to disturb it too much, then the wax will come out. But certain people, they like to clean the wax using the Q-tips, okay, the cotton bud. Some even using the hook, the metal hook. Yeah, so we really seen a lot of patients after they clean the ear, just out of sudden, there's one case actually when the ladies after shower, a young lady actually, she cleaned her ear, then suddenly a cat, her own cat, just walk over, then she get a shock, and he just pushed the ear, the cotton bud into her ear. Then after that, you know what? She complained already. She
Yes.
couldn't hear, she cannot hear. Then she has some bleeding. Next picture, this will show you how. Aliyah, can you put the next picture?
So, is this
Okay.
one?
No, the previous one.
This one?
No. Lower. The last pictures.
Okay.
Last.
Picture. Okay.
Okay. On top of it, above it, above this
Okay.
picture.
Above this picture. Okay, doctor. Wait, let me go back to full screen. Is this the one?
Yes.
Wow, very bad.
You look at this. This is the ear canal. Towards the end of the tunnel, you can see this is our eardrum. Okay, inside the eardrum, you can see the ear ossicles. But if you look properly, there is a perforation here. You saw the hole or not? Okay.
Yes.
Yes, this kind of, and you can see some blood over the side there. All right. This is called what we call a traumatic injury to the eardrum, or medical term we call tympanic membrane. This can be can be injured by the cotton bud, like these ladies that I told you. Yeah, she injured her ear. Then another common one is by slap. A person who slap on the face, sometimes it may actually, our fingers will, hit the ear. This kind of impulse, the pressure, actually can break the eardrum. Another one is even more, you will be surprised. We always love our kids if you have families, right? Some parents, they like to kiss the kids, right? Sometimes they kiss their ear. And there's one patient, after kissing the ear, then they actually perforate the eardrum. The child start crying. Okay, this is commonly happen That's why what I would suggest you, I mean my advice, try not to clean the ear
I see. I
with
totally
the cotton
agree.
bud. Mm.
Doctor, I still recall last time I sent one patient aged 90 years old to you. And then that time I really from the diagnosis from ear check, we really cannot tell that what happened inside the ear because there is something like looks like fungus, but it's not like really fungus. So it's something like the with some cotton strange, but when I look at it, it looks like fungus. So when I sent to you that, I was surprised you sent me those pictures that you have taken out from my patient. It's actually a bunch of these earwax. Not sorry, a bunch of this ear cotton bud strange. So over here, I will also recommend others don't use the cotton bud, especially when you know that for cotton bud when we roll when you use it and then you go and like doing this how to say movement. So the strain of the cotton is actually getting looser and looser, and some of them will be left inside,
Okay.
right?
But
So
you'll be
thank you, Doctor.
surprised a lot of people they enjoy cleaning the ear by this roaring movement.
Yeah, it's true. It's true. So, Doctor, would you show more cases? What is happening in this picture?
Okay, so you have some brief understanding about how our ear looks like. Okay, before I go to this picture, you see how I'm taking this picture. This is important, isn't it? I mean, for us to look into the ear, we have some instrument we use. One of them will be the otoscope. Another one, like now, is quite because of the technology, people even use the handphone, actually with some device, actually they can capture this kind of pictures. That's why with this kind of pictures, give us a lot of understanding, give us a lot of uh, ease, to explain to patients about their own ear. Okay, looking at this patient, this is the right ear. So this is the ear canal. Then towards the end, again, we can see this is the eardrum. Okay, but if you look carefully, maybe I should ask someone, do you see any abnormalities?
I see something like the water, like
Yes,
bubbles behind it.
correct. This is the bubbles that actually behind the eardrum. Okay,
Yes.
you can see the bubbles here. Yes, Alia, yeah, you are showing the bubbles. Okay, and why there's a bubbles inside the behind the ear canal, eardrums. Okay, behind the eardrums, this part of the ear we call middle ear. Remember just now I show you the pictures that about the middle ear
Ex-
there's a tube that actually to drain the waters and equalize the pressure from the inner ear middle ear to the external environment, okay, through the nose lah, okay. So this eustachian tube, when it is blocked, so the fluid in the middle ear will accumulate, okay, it will giving this kind of fluid collection in the middle ear. When this happen, this is like we are listening in the water, okay. How to be clear, you see, you can't really hear well. And this is commonly seen in pediatric age group, okay. Pediatric age group, why? You see, in kids, they got a lot of running nose, okay, flu-like symptoms, especially when they, like now because of this corona things, people wearing masks. But previously, they want to spread this kind of flu virus. It's very common and it's very easy. You see, yeah, just a sneeze in the class or in the kindergarten or in the nurseries, then you can see this will spread among the kids in the rooms. You see, so when the infection or rhinitis or this kind of flu symptoms, they will tend to have a lot of mucus. This mucus is basically can block the eustachian tube, or
Correct.
if not blocked, at least it partially blocked. So it make the drainage of the water, the fluid in the middle ear inefficient. Then it may collect inside, so that the kids or the patient may present with reduced hearing. Can you imagine if this kind of reduced hearing, it happens in a child who are still developing, are still growing and still want to learn more, want to listen. So a lot of people, kids are 2, 3 years or come, then when we assess the hearing, speech, the mother say, yeah, they talk very palate. They say palate. They talk either the front or the back, missing some words, then we have to be careful. We have to look at the age of the child. If it's too young, let's say if less than 1 year old, the child not really can talk, isn't it? But if it's 2 or 3 years old, he's still talking like that, maybe something wrong, maybe. Either it's a impacted wax inside, or it can be due to this effusion if the child always have running nose. So this is important we detect early so that we won't affect the child's development because they need to hear in order to learn, in order to speak, right? Yeah. So in
Yes.
adults, if we see these kind of things, as what I said just now, it could be due to some pathology at the back of the nose that we have to raise our eyebrow, we have to look inside. Okay,
Correct.
this is
Correct.
okay.
So, doctor, thank you for sharing about this middle ear effusion. So, for those who are not very clear what is this about, actually, this is a condition whereby our middle ear is full of fluid, and then because of that, the person is not able to hear clearly. So, for example, especially for parents, if you notice your child having some reduced hearing suddenly, how to actually capture. Normally for audiologists, we will ask the questions. If you call your child from behind, are they able to turn their head and look at you? Or when you call them, they actually always require you to speak louder so that they can answer you. So these are the symptoms that the child may be having some reduced hearing, and it's important that you bring your child to see ENT for a check. So if doctor see this condition, then doctor can do some magical treatment for your child. Okay, so doctor, would you like to just briefly explain, since over here, sometimes for Sun Life, we also will receive some patient with middle ear effusion and we will refer for ENT treatment. So would you like to actually explain a little bit what would be the treatment you will do for this one?
As you know, if we can see the bubbles, this is very clear cut, okay, that the patient have some reduced hearing. Sometimes I do refer these kind of cases to the audiologist to confirm it, okay. This kind of disease, it can be dangerous, right? Not only for the child's development. In the long run, if we miss this kind of diagnosis, the child usually, well, most of the time, if they never complain about hearing loss, they can go asymptomatic, okay, unnoticed. They can go unnoticed, okay. But with this disease, but the disease is still there. It can progress. Once it progress, it actually can cause some other problems in the ear, like the one we call the adhesive otitis media. Means the entire ear. You can imagine if the fluid inside our body will absorb the fluid away eventually. Okay, but when they absorb, because the eustachian tube is still blocked, this eardrum will get sucked inside. We call it retracted. This eardrum will get sucked inside, and then it may adhere to the wall at the back there. Once it adhere to the back, this is what I call adhesion, adhesive otitis media. And this is definitely in future, the patient not only have hearing loss, it may present with sensory hearing loss as well. Okay. Well, so the treatment, of course, we have to detect early. Then we have to give a medical treatment like medication. Okay. As you know, again, this kind of condition is common in people with, especially kids with a nose issue. So when the ear present with the ear symptoms like this, the otitis media effusion, we treat the nose. Okay. Then you can see once the tube is like opens up, this is like when our toilet, if opens up, the block is already clear, then the fluid will go. It will get drained. Right. So it's important we identify the situation, the condition, then we treat the nose. Most of the time, this effusion will recover. Okay.
Doctor, I also know that sometimes you all will do some surgery for this ear, right? Like you just cut on the eardrum and then put a grommet tube. So under what condition you will consider to perform this test? I mean, this operation instead of like treating the nose.
Again, we look the patient as a whole. Well, then we have to ask ourselves whether this effusion will cause any impact to the patients or not. All right, in kids, if they are having the unilateral one side otitis media effusion, the other ear is still hearing well. Okay, we can wait because most of the otitis media effusion self-limiting. It will get better when the nose clear. We won't have a flu or running nose for continuously few months, isn't it? Unless the patient have allergy or something. All right. Otherwise, if just a flu-like, usually it will resolve. If any unilateral otitis media persists more than 6 months, then maybe we may consider to do the surgery to clear the fluid out. Why? Because to prevent the long-term complications, as I mentioned just now. But if a child presents with bilateral otitis media effusion, OME, both ear, then this is important because both ear, the child cannot hear well. All right.
Correct.
Can you imagine if they can't hear well, how they're going to develop the speech? Isn't it?
Yeah.
How they're going to attend the class. Furthermore, if they sit at the back row of the class with this effusion, I know if I recall, allow me to recall back when I was young. I think this is quite common situation happens, but without
Yeah.
notice. Yeah, those kids actually they
Yeah.
are very smart, but because of this effusion, maybe they they lost interest in study. Okay, well, so if this kind of case happen, bilateral effusion, the most maximum is 3 months. If more than 3 months it still persists, then we need to do something to clear the fluid out. Yeah, this is the
Okay.
indication for the surgery.
Okay, thank you so much, Doctor, for your insight. Over here, we have few audience who is online. Hi, Dr. Chin. Thank you for tuning in also. And hi, Shalom, Kai Chi Lee, and also others, Marcus, Deng Yueqing. Thank you for tuning in as well. So feel free to actually type your questions if you have any questions about ear and you want to ask doctor. So when we see the questions, if we have time, we will actually answer your questions. And not only that, for those who feel like this video actually benefit others, feel free to share it to any other Facebook group or in your personal Facebook as well. Thank you, Marcus. So, doctor, what is the other situation that you will tend to encounter in your clinic? Like
Other situation.
this one, oh my God, this is
Oh,
ugly. How could this happen?
well,
Is this real?
this is just happened actually about less than a month ago. A young guy actually, yeah, how young? I think in his 20s. Yeah,
Okay.
he came in very panicked with his father, almost crying already. His first complaint, and yeah, that was a Sunday actually, the Sunday morning. He rushed into the hospital. He said, "Doctor, please help me. I'm going to kill myself. Something is inside my ear and it's keep ringing and it's biting me and I'm trying to pull it out and it start. Then I saw the blood. Then I feel so panicked. Please, doctor, please help me."
Oh my
First,
God.
first this,
I sure will cry.
yeah, yeah, you can see the child, the patient is really panicked.
In
Okay,
pain. Yeah.
well, this is an insect. The insect, how the insect going into the ear? Basically, the common insect that enter the ear, there are three. One is the ticks. Ticks. Those are
Ticks.
who suck on the blood one. The second one is actually ants. So the third one, I think is very girly lah. This is a cockroach. Okay, cockroach.
Yeah.
Well, so most of the time, when we further history, then we notice that either they eat on the bed, they're having that kind of You know, this insect, they will be attracted by the food only. What they want is food, okay? So
Okay.
they will find some place like this, then or they accidentally enter the ear. Because it's an end tunnel, once they enter, they don't know how to reverse, you see. So they're stuck inside. Then the insect
Okay.
also will get panic. When they
I
start
see.
panic, they will start biting.
Ah.
Yeah, biting in the ear. Wow, that is very painful. Even though I never
Okay.
experienced it, I looking at the patient expression, I know it's very painful. So what
Doctor.
are we going to?
Yeah. So sorry. Is it continue?
Okay, so when this situation happen, what you should do? You shouldn't panic. Okay, first.
Mm.
Then we know it's still alive. What we need
Mm.
to do is to drown it. Okay, since this is an end tunnel, you put some water, or usually what we will put is oil. Okay, olive oil or even
Mm.
cooking oil. All right,
Mm.
you just pour the oil into the ear to drown the insect. Once the insect is dead, so it won't bite. Okay, it won't bite you. Maybe by
Mm.
chance, when the oil flow out, the insect will flow out is as well. If that's not the
Mm.
case, in case if the insect is too big, it's stuck inside, then I have to remove it for you. Okay,
Okay.
how we remove this? You can see this is a small instrument that we take it out. So our principle is very simple. We we remove anything in the ear. Can you imagine this ear canal is just 7 millimeter in diameter. All right. So
Yeah.
we remove this. There's a picture, Alia. Can you show the last pictures?
Sure. Okay. Let me go to the last picture. Uh,
Yeah, this
is
one
this the
correct. The last
one?
one correct.
I see. All right.
If you look properly, there's a microscope that I'm looking into
Mm.
the child ear, you know, to remove any foreign bodies, including the wax, the pus, or anything,
Mm.
from the ear.
Mm.
Yeah, this is how we remove the anything in the ear. Okay. Yeah, the common
Okay.
one is the wax, then the foreign bodies.
Yeah. So many people may not actually look at the wax. Let me show you some of the picture. So,
Yeah. This the one, yep,
so this is the wax, right, doctor? So just
correct,
now you do explain that our wax normally is actually produced by the hair over here on the one third outer part of the ear canal. Am I right?
correct, yes,
Correct. But however, normally, I do advise, I also do advise my patient don't use the ear digger or the cotton bud because it's an end tunnel, right? So when we use those things, we are pushing the ear drags deeper.
yes, yes.
So that's why
Um,
this is a one. Yeah, maybe you want to educate a little bit to our audience why we shouldn't do that.
a lot of patients ask me, Doctor, why we need the wax? It's a foreign body, isn't it? I said, no, earwax is produced by our own bodies.
Yeah.
Then he said, yucky, why we need the wax? So smelly and But
Yeah.
I would tell them straight away, because of the wax, it helps to
Mm.
protect your ear from getting infection. And in fact, a thin layer of earwax in your ear canal, it helps to conduct the sound. You can hear better.
Oh,
All right.
really?
Yes, yes.
Okay.
Okay, I mean the wax not until it impact the whole ear canal lah. Of course, then it will block the
Mm.
ear. Okay,
Yep.
and also in this wax, it actually has hyaluronic acid. It got lysozymes. Okay, and all this is to protect us and to clean the debris out from
Mm.
our ear, in the ear out. Okay, and also you know what is wax, right? Wax is a hydrophobic. The water
Mm.
cannot enter. Right? You see, if it's a tunnel like that, it's dark, isn't it? If the
Mm.
water, like when we take shower, the water easily entering into the ear canal, what will happen? Wet and also dark. There's a
Mm.
picture later I will show you. uh,
Okay.
that is what will happen, okay? Infection, okay? The infection in the ear. That's why the earwax is normal. Then it will
Mm.
be it clear by itself. So, and some more it's over the outer one third of the ear canal.
Mm.
All right. So So that's why when you use a cotton bud, you can actually push the earwax further deep into the ear canal until it impact in the eardrum. That will definitely cause a lot of hearing loss. And you may not only the hearing loss, you may hear some sound in the ear, what we call tinnitus. All right. So it can
Mm,
create a lot of problem and it's very difficult to remove. One is near the eardrum.
yeah,
Okay.
correct.
Mm.
So, Doctor, just now may I ask, just curious, actually, during your previous slide, right, the one with the insect, I keep on wiping here because it's already so ugly that it elicit me to tears. So, may I ask, is that if let's say we have a little bit of wax, is that safer and it prevent the insect to direct attack our eardrum?
Exactly. You know mothball. If you
Mothball.
if mothball like the one we put in the cabinet in the cupboards, trying to prevent the cockroach from enter
Uh
from
huh.
to
Yeah.
chase away the cockroach. Yeah.
Mm-hmm.
If you try to smell your wax, maybe you will feel sound like mothball.
Oh,
Okay.
really?
The
I
earwax
see.
have some have some smell, isn't it? That's why
Mm,
people feel ew, yuck. Okay, that kind of
mm,
smell. It's actually
mm,
if you don't like it, I think those insects also don't like it. It's actually
mm,
trying to prevent, all right, this kind of insects or animals or haiwan or whatever, these things to entering into our ear canal. Yeah.
mm. I see. Okay. So, Doctor, I we do have some questions from the audience. There is one audience asking, how would we know whether water has entered baby's ears like 4 months old, and what is the symptoms? How can we get the water out of the ears? Well, baby ears, I thought it's only like 1 cm for the ear
Yeah.
canal.
Okay, the baby ears,
Mm,
babies, their ear
mm,
canal is also narrow. It's not so
mm,
easy for the water to enter.
mm,
Okay, if when we take shower for baby, usually we will just use a towel to wipe on it. Okay, the head or all that. It
mm,
shouldn't enter the ear canal. But what if that happens? Baby cannot complain. They won't complain. Okay, that's why a
mm,
lot of parents also they are a bit cautious, I would say, or very anxious when they taking shower for the baby, of
mm,
worrying that water may enter the ear. But in the
mm,
normal circumstances, usually the water won't enter the ear because of the wax.
mm,
Okay,
mm,
but if that happen, well, how we know? Seriously, what you can see if the child have, the baby, even they cannot complain. Sometimes they keep, moving their ear. Okay, or when you touch the ear, they start crying. Okay, means they are very uncomfortable. Maybe in the ear is very uncomfortable. How to see actually very difficult if you don't have
mm,
any instrument. Even for us to look inside the baby ear canal, we also need the instrument to look. Okay. Yeah.
mm,
If you suspect some things, you know, then you can bring the baby to have a check. Not only the ENT, the otoscopy, that otoscope is actually commonly available in most of the GP clinic as well. Also in the pediatrician clinic, they can actually have a look inside the ear canal. Okay, if there's fluid, it's wet, then we know. Sometimes it's unnecessary for me to put any ear plug or to block the ear while taking shower for babies. Okay.
mm,
Some people they have some remedies, I think. Yeah, they use a cotton. Okay, a cotton. They roll it
mm,
into a ball. Okay.
mhm,
Then they dip the cotton in the olive oil. Not the whole
mm,
thing, I mean part of it. Then
mhm,
the oil part, they the oil part exposed outside. The inner
mm.
part they block into the ear. Yeah. You understand what am I trying to tell you? I mean the cotton ball, you roll it as a ball, you dip part of it in the olive oil lah, any oil base, and the
Mm.
other side, then you block into the ear. And thinking that this can actually prevent the water from entering it. Well, if you're really worried, maybe you can try to do that. But again, you can't really access the ear canal. You don't know what is inside. You don't know what happened. You not even know whether the water entering or not, isn't it?
Mm.
So
Yeah.
yes, in this situation, Okay, I will allow you to use a cotton bud, but only for the external part of the ear pinna, means the ear pinna here,
Doctor,
up
I
to
will
the
say that.
opening.
Oh, okay, yeah.
I'm not definitely not inside the canal, okay? Not inside the canal.
Mm,
This can actually clear away the water outside. Okay.
yep. So normally I do understand that some people they feel like inside the ear is a bit wet, and then when they use the towel they also cannot clean it. So correct me if I'm wrong, which is the place that we can really clean and put the Q-tip is actually only this area, which is the outer part, right? Deeper than
Correct.
that, it shouldn't
Correct.
be recommended. So I myself also have seen one patient in my clinic that he visited us, and then he said that I have perforated eardrum since like 20 years ago because the use of Q-tip, I accidentally poked my ear and it never grew back. So this is a very good knowledge for all the parents. Please don't use the Q-tip. And another thing also, sometimes I think children is very easy to get traumatized. When the parents try to clear their wax, right? What happened is that when the children is moving, it actually hurt their ear canal. So when the children have this impact, the ear pain sensation before, they will be very reject or very afraid any other doctors or even audiologists to touch their ear. So I would recommend parents, please don't simply clear the wax for your children. Yep. So
All right.
another, we also have another questions, which is, okay, earwax protect. Okay. All right. So now we will see other ear condition, doctor.
Yeah, under other condition, yeah. Yeah, you can
Okay.
show some pictures.
Okay. Other condition. So doctor, what is this condition about?
Again, this is the ear canal. All right, we put an otoscope, or
Mm-hmm.
now we use endoscope. You know, endoscope means it's a camera. It's like a
Mm-hmm.
still. You know, we put into the ear to capture the
Mm-hmm.
pictures. So
Mm-hmm.
in last time, maybe actually about maybe 20 years ago,
Mm-hmm.
this kind of technology is not commonly available. Okay, and a lot of times you only listen to doctor. What the doctor say is what the doctor say. The diagnosis. But now we can actually show with this kind of picture. Actually, we educate the patients how important is our ear, how to take care of our ear. You see, when you look inside the ear canal. Okay, this patient is again all young people, 30 over years old. Okay, ladies. Okay, came to me with, doctor, I'm very itchy my ear. Okay, ear itchy, ear itchiness,
Uh,
very itchy, and it blocked. And this has been there for past 2 to 3 weeks. I already seek treatment with doctors in the clinic. They given me some medication to put the drops into the ear. However, it's not getting any better. In fact, it's getting worse. That kind of itch, now I start having pain. Okay. So I say, well, can I touch your ear? Then I would, okay, this is what I always, uh, when we examine the patients, we always ask first, isn't it? So when we touch the ear, then roughly we know what's going on. Okay, if the ear is very painful, there's an infection in the ear. And in this case, it's not really painful. But when I put this endoscope to look inside the ear, this is what I saw. You can see a whitish fluffy. This is like fluffy, like a cotton bud, isn't it? Like a cotton,
yes.
over the wall. Then you can see a spores, the yellow spores. This, if you can recall, if you have that kind of experience to see a a a, a bread, you left for a few days to weeks, then you will grow the fungus. You know that kind of fungus. Okay, this is a very common uh, pictures for patients who present with otomycosis, means a fungal infection in the ear. Okay,
So
the
how to
fungus
treat this problem, doctor?
fungus is a very uh, how to say, it's a very strong organism, you see. It's very
Yeah.
powerful. It's very
And it can
difficult.
spread very fast, right?
It's very difficult to kill and to treat because they are very stubborn. They are very stubborn. Okay, let's say like if we have a fungus over the skin, once we treated, maybe in future it may come back again, you know. So it's very stubborn. Especially in the tunnels. Remember just now what I told you? Without the wax, water can easily enter into our ear canal, and somehow it's a dark tunnel. All right. So the fungus like it because that kind of environment encourage the growth of the fungus. Okay.
Okay.
Then the
Alright.
fungus once it grow into the ear tunnel canal, is difficult to eradicate. What we need to do is not only the eardrops. We need to clear all the debris out. All these fungus we need to clear it out by careful cleaning using the suction machine or using a mopping. You know, you see it's very near to the eardrum. We
Yes,
have to be
correct.
very, very careful to clear all this fungus away. Then we have to treat. Then every week we have to clean the ear. Okay, every week we have to clean the ear. We may put some medication inside. And even with such an intensive treatment, sometimes the fungus still grow back. So just bear in mind, as a reminder to all, all the audience here, don't uh, don't use a cotton bud to clean your ear. Okay, try to keep the ear always dry. Why I say cotton bud? Cotton bud, yeah, doctor, cotton bud is to dry the ear one, so it's good, right? Actually, cotton bud. Okay, there are a few cases. No, actually, it's common. People put the cotton bud in the toilet. Taking shower there, so it's moist,
Yes.
the environment. Even though the cotton looks white and clean, but you do know the spores, okay, of this fungus, you know, which is floating, it may stay there. Then you may conveniently put the fungus into the ear, okay. And also the fungus, like what Adia said just now, when you roll the rolling movement of the cotton bud, you can loosen the cotton. Some cotton may left inside, like this case. Yes, Adia, thank you for the picture. You see some cotton left inside, and this fungus is actually growing on top of the cotton, and together with some wax. You see some wax on the top there, the brownish color wax. You saw or not? Yeah. So
Yep.
try
Over
not
here.
to. So that's why the story, the lesson learned today, the cotton bud. I'm so
Yeah.
sorry for the manufacturer of the cotton bud, but we definitely use cotton bud for other reason, but not in the
Yes.
ear. Okay.
Correct. Correct. So, yes, I think now we have someone asking about some questions. Is it okay to wash our ear with small amount of water, doctor?
Whoa! Do you know that there is, in my surprise, okay, there are there are people that actually cleaning their ear by showering their ear. Okay, when they take shower, they just tilt the head, let the water showering inside. Then they turn, then they jump, let the water out. So this is
Yes.
like we accidentally, you know, water entering while we swim. This is what we did, isn't it? But
Yep.
in normal circumstances, again and again, please don't do that. Okay, water. Okay, again, the wax is over the outer part of the ear canal. It's hydrophobic, means it prevents the water from entering it. So if the water accidentally enter the ear canal, because of the wax at the outer part of it, the water will be very difficult to come out. No matter how little is it, it will moist the ear canal. Again, you are asking for trouble. The fungus may come. If not,
I
the
see.
bacteria may come, you see. Or maybe insect will come.
Yeah, true. So
All
I
right.
think thank you so much, doctor, for your sharing today. So we are nearly reached 10 p.m. So our live will stop at 10 p.m. Over here, let's go through some of the questions. All right. So over here, Sharon actually asked that regular use of earphone can cause problem to hearing. So this is more on the hearing. So Sharon, I would say that if let's say the person use the earphone at the volume, which is a dangerous volume, normally the volume around maybe 90%, 100%, or above 80%, because depending on the earphone manufacturer, the limit how much they can go, then the person is long term using that kind of volume can actually bring some hazard to our hearing. So one of the way is you need to reduce the volume, better to reduce below 60%. Yes. So doctor, do you have anything to add for these questions?
Yeah, you answer all. Good.
Okay. All right. So other than that, let me go through some of the questions. Yes, it's true that. Thank you so much, doctor, for sharing. One of the audience answer, oh, they are first time hearing that earwax protect the ear. It's a new knowledge to them from AV. So other than that, okay, over here, okay. Okay, doctor, there is one audience called Kale, Seal, asking that when we do the ABR test on the child and indicate that the child has some hearing loss, all right? Normally, what is the cause of this kind of hearing loss, and is it a permanent hearing loss?
In child that who need ABR test, usually
Mm,
in a young age, okay, very young child, all right, or for those who are cooperative, usually we can do a play audiometry or visual audiometry, that kind of hearing to test the child's hearing threshold. Okay. But in a child who need an ABR test, most of the times we are testing for sensory neural hearing loss. Okay. But the ABR, okay, what is ABR? It's auditory brainstem response. Means they put some probe over the your skull. Okay. This is to detect the sound the brain electric activities of the hearing. So this kind of test actually is very very good because it is objective. You cannot lie on that. Okay, and it is definitely if it detects some problem, you have some problem. All right. So this kind of test it will tell us whether you have sensory neural hearing loss, conductive hearing loss, or mixed hearing loss. If conductive hearing loss usually is treatable. Okay, even sensory neural hearing loss. This one, I think, Aliyah, you will have a talk with our Prof. Gore, isn't it, about the hearing loss?
Yeah,
Yeah.
we will talk. Actually, next week, Sound Life is honored to invite Prof. Gorbisi, ENT surgeon, and also the cochlear implant surgeon from UKM Specialist Center. So she will share with us she will share more about this permanent hearing loss and what is the solution for the children. Basically, it's a cochlear implants. All right. So we will share a little bit more. And over here, doctor, I do found some of the picture in my slide. What is the ABR? Maybe you can base on this test to explain a little bit more. Let me
Okay.
share the picture. Yeah. All right.
So again, come to this ABR. So in a child with hearing loss, for a kids with a hearing loss, it's very difficult to detect. Sometimes we can be picked up by the parents or by the doctors.
Yeah.
Most of the time, like pediatricians, they can detect by some telltale sign. You see, if the
Yes.
response, if that's why the earlier we detect this kind of hearing loss is the better, because if sensory neural hearing loss happen in such a young kids, young baby, most of the time it can be bilateral, and this will
Yes.
affect the child. Like what we say is they're deaf. Okay, they cannot
Yeah.
really talk. Okay, so and this will really really help by a cochlear implant. All right.
Yeah.
Okay, come to
So
this
maybe,
test.
yeah, doctor, maybe
Okay,
I explain the test further. So
sure.
normally for this ABR test is done by the audiologist. As you can see over here, we will put some electrode and then we will put the probe, which is produce the sound stimulus to the baby. And not only that, we normally also, and this is a test result. If let's say from the test result, no, we will get the response at a high intensity, and when we make it softer, we also can get the wave meaning the child having normal hearing. But if let's say when we are presented at the maybe only high intensity loud sound, we can get the wave, but at the softer sound, we can't get it, then very likely the child is having some hearing impairment. But from the ABR test alone, we cannot really test that the child is having sensory neural, which is a permanent hearing loss, or the conductive hearing loss. So that's why we will always do the diagnosis also together with other tests. For example, this is a middle ear test. We use this tympanometer to do the test. And not only that, for we are also using this OAE machine, which is the inner, we can test the inner hair cell response to actually find out that whether the child is having some problem with the cochlea. So by combining all these test results, so we can actually give a diagnosis, that impression whether the child is having the permanent hearing loss, which is we call it sensory neural, or we are actually having this conductive hearing problem. So of course, conductive is actually referred to the ENT for management. So this is something that overview, that if let's say the children less than 3 years old, then normally if hospital got provide this newborn hearing screening, they usually use this OAE machine to do the test. So if passed, then we will just discharge and ask the parents to monitor the children's speech and hearing. But if let's say refer, then we will actually need to do more further diagnostic tests, which is we call it ABR, auditory brainstem response, and also tympanometric tests. So for children more than 3 years old, sometimes they're having some speech delay, then we will do a slightly more test, which is this test is called pure tone audiometry test. We have two types, VRA and play audiometry. Actually, last week we already covered this topic and together with Dr. Chin. So for those who miss out this topic, feel free to watch back our live last week. Okay, and this is the test when the children is like playing, then we do the test for them. So in Sound Life, we also can provide this play audiometry for age above 3 years old. Okay, so
Yep.
yes, doctor.
This is basically how we assess a patient, a child's hearing, because we cannot ask them, "Hello, baby, can you hear me or not?"
Yes.
So they won't respond to you. They look at you. What this auntie trying to say? You see. So this kind of
Yes.
test is what we call objective test. This is how we detect the hearing loss earlier. Of course, this is by the machine test lah. Clinically, we must have a very high degree of the sensitivity lah. Means when you suspect something, then you try to clarify. Especially nowadays, a lot of things you can ask. Okay, a lot of things you can find out from the internet or that. If you have any doubts, you can always come to the audiologist, to have a look, to assess the hearing. Like your child have some, difficulty in reading the books, you will spontaneously will go to optometrist. Maybe she has some refractive errors, maybe need a glass, something like that. You see, so the ear is very equally important as our vision. Okay, and a lot of people tend to forget, not really take care of their ear. Okay, and until one day they have a problem in the ear, then only they realize. Okay, yeah.
Yes, correct. So, doctor, we have one audience who is very keen to know from Jacqueline Ching. So, hi, Dr. Gan. She's asking, will diving or swimming cause damage to our ear? So, maybe, doctor, this will be the last question you would like to answer.
Well, this question, are you a swimmer? If you swim as a hobby, usually no issue lah. There's one thing we call swimmer ear. Swimmer ear, again, this is same principle. Swimmer ear means the water in the ear. So swimmer ear means infection in the ear. Okay. So if your ear always wet, yeah, you are asking for problems. I mean, the infection can set in. All right. So there's one particular conditions happen in people who exposed to water a lot, not only swimming, okay, like fishermen, those are water sports, sportmen, all that involve the waters. They may have some things we call osteoma. Osteoma is actually a growing bone. in the ear canals. You know, our ear canal is developed by the bony inner part and the cartilaginous outer part. That bony part of the ear canal, if always exposed to water, it can actually have a reaction to the body, to the cold, the cold water by increasing, by growing. Okay, so this osteoma is actually means that the growing of the bone in the ear canal, this kind of growing can actually narrow down the ear canal and it may block the ear and causing some conductive hearing loss. But it's not commonly seen, okay?
I see. So meaning to say that if let's say for those regular swimmers, which is not like maybe once a week is considered not regular, right, doctor? This one is just like for hobby.
I think it should be fine,
Well,
or there are actually methods of taking care of your ear while you're swimming. A lot of people they put ear plug, you know, the ear plug. I think Alia, you have a very nice ear plug that
yes.
you did it for me. Yeah, that actually can block the water from entering the ear
Yes.
canal. Yeah, maybe
Yes,
you
true.
should get one of it.
Yes. So actually, Sound Life can actually take your own ear shape impression, and then we make a custom made earplug for yourself. So if let's say you really swim a lot and you want to lessen the chance of water enter the ear canal, then feel free to come to us and we can make a earplug for you. Unfortunately, today I don't have a sample to show. Okay. So, doctor, another thing is that if let's say the person is diving, so you know that normally diving we need to equalize, right? Equalize the external and the internal. So there is one time one of my friend asking me that when we dive, should we actually wear earplug? So what would be your answer to that?
Um, at first you have to understand the principle, okay? The what do you mean by the pressure difference? Okay. Eustachian tube is important to equalize the pressure. You see, our eardrum is actually a partition, like a wall separating the external ear and the middle ear. Both these compartments, the inner middle ear and the external ear, are filled with air. Okay, they are filled with air. So it's the same medium. All right. So the eardrum only can move freely, isn't it? So if the eustachian tube is blocked, so you will have some different pressure inside. That depends on whether you are diving or you are taking the plane, you see. When you dive, so the external pressure is higher compared to inside. When you equalize the pressure by swallowing, open up the eustachian tube, then the pressure inside and outside will be equalized, isn't it? So when you put the ear plug in the ear canal, does that really help to equalize the pressure? Which is not. I don't think so. All right. So I don't think that will help. The most important when people dive, I think if you are a diver or trained to dive or what, you sure they will teach you first. You need to equalize the pressure. You need to
Correct.
swallow, keep swallowing. When you go descend deeper and deeper, you need to swallow. Yeah, to equalize the pressure. Otherwise, you can injure your ear. This is what we call a barrel trauma into the ear. It can be bad, okay? It can be very bad. All right. That's why it's important to know that you have to equalize the pressure by swallowing to opens up the eustachian tube.
So meaning to say that earplug is only suitable for them to be used when swimming, which is on the surface of the water, but it's not really recommend for those who are for diving purpose.
Diving, yeah, maybe not. Another one, earplug is actually like the earmuff or that, to reduce, to dampen the loud noise. Okay, that is for protecting the ear from getting damaged by the loud noise. Okay,
Correct, correct. So thank you so much, Dr. Gan, for your sharing today.
welcome.
And next week, we are actually having our new doctor, another doctor, Prof. Govisi, is going to share with us the second chance to hear again. So she will share a bit more on the cases like children who is diagnosed of having this permanent hearing loss since young and how cochlear implants can actually bring the second chance for the children who is originally totally profound, severe to profound hearing loss to hear again. So stay tuned to our live next Friday, 9 p.m. Okay. So another thing is I'm also Dr. Chin, who is the speaker for our guest last week. Now he's also having the Chinese Mandarin live at his platform called Dr. Chin. So feel free to tune into his live after this. Okay, Doctor, any last word for the audience today in summary?
You see, the first picture that I show Aliyah, the structures of our ear, as what I told you, is very important. If you understand how the ear works, how the hearing works, then you will know how to take care of your ear. Okay, the most important part that people can disturb their ear is the external ear. Anything beyond the eardrum, you can't do anything, right? You won't go and disturb so deep inside. That's why, so the external ear is very important and it's frequently get injured, okay, or frequently have some disease. Either it can be self-induced by the cotton bud or that, or it can be due to infection. Maybe indirectly also related to our habit, okay? So this habit is really not good. You shouldn't have this kind of habit of cleaning your ear using a cotton bud. But okay, to be frank, I mean, to be fair to those who clean their ear using the cotton bud, I personally seen quite a few of them cleaning their ear without any issue for their past 20 or 30 years. I will label this group of people as a they are perfect ear digger. they can they can clean their ear so well without any issue. So the tricks about this. When you
Yeah.
clean when you clean the ear, the size of your cotton bud is really
Yes.
does matter. If it's a huge one, please throw it away. A
Yeah.
small one, but have a higher tendency to injure because it can reach your ear
Deeper.
deeper in your eardrum, you see. So you must be very careful when you clean the ear. Basically, you have to clean the ear with the door locked without anyone can come in.
Yeah.
But
Yes.
in general, please try not to do that.
Yes.
Okay.
I think the way you hold the ear tip is also very important. Because some people I saw that they like to hold like this way, which is anything touch on their hand, injured could happen. I myself
Correct.
had the actually when I was like maybe 10 years old, I myself actually injured my left ear once. And since then I always can hear loud sound buzzing zzz, like this.
Yes.
It's like less correct compared to the right side. So there's definitely impact. Many bad things can happen to us if we continue to disregard Dr. Gan advice today to continue use the
Yes. Yes.
Q. So we do advise our audience over here don't use it if possible. Okay. So just for a shout out again, thank you Dr. Gan for coming today. And then thank you for your insightful sharing. I think our audience over
My
here
pleasure.
enjoy it very much. Okay. And besides that, I would also want to shout out that this month, Sound Life Hearing is doing, because of this World Hearing Day, fall on 3rd of March, Sound Life Hearing is doing this diagnostic hearing test promotion, buy one, free one. So for those who haven't done any tests before, feel free to come to our center and you can actually contact us, make appointment with us at this phone number, or even come to our center, which we may actually type out. Otherwise, if you suspect yourself having some ear problem, nose problem, or even throat problem, can always go to Columbia PJ, which is Dr. Gan is
you.
practicing over there. All right. So that's all for today. Thank you so much for tuning in and sorry for the delay. Thank you so much. Bye bye.
Thank you, Aliyah. Thank you all.
Thanks. Bye.